So good afternoon, everyone. Thanks to the organizers for giving me this opportunity. So my topic is Tepotinib in Asian patients with advanced NSCLC with MET exon 14 skipping mutations, and this was presented as a poster in ASCO 2022 this year. Background: we all know that MET exon 14 is present in 3 to 4% of advanced NSCLC patients, and Tepotinib is an oral, once daily, highly potent selective MET inhibitor. It is approved for use in several Asian countries. In Vision trial, which was a phase 2 study, Tepotinib was studied, and this had led to an objective response rate of 49% and a duration of response of 13.8 months in patients with MET exon 14 skipping mutations. The present study outcomes of Asian patients from Vision study are reported. So they have included advanced NSCLC with MET exon 14 skipping mutations detected either by liquid biopsy or by tissue biopsy. Patients received 500 mg OD dose of Tepotinib. The primary endpoint was objective response rate. In this particular analysis, efficacy was assessed in 79 Asian patients who had 3 months or greater follow-up, and safety was assessed in 88 Asian patients. HRQOL was also assessed. The baseline characteristics: out of the 109 Asian patients which were enrolled in Vision study, 79 patients had a follow-up of greater than or equal to 3 months. The median age was 71 years, approximately 38% females, 42% smokers, ECOG PS 0 and 1 only included, and brain mets present upfront in 16%. Important to note, first line therapy, this Tepotinib had been used in 33%, and almost 2/3 patients had received some kind of treatment earlier. So coming to the efficacy, overall response rate was 54.4%, median duration of response 18.5 months, PFS 12.5 months, and OS of 20.4 months in this subset of Asian patients. The overall response rate was 66.7% in those who received it as the first line, and 48% in those who had some kind of previous treatment. The objective response rate as per the subgroups: all subgroups irrespective of age, sex, smoking history, PS 0 or 1, presence of brain mets at baseline did respond. Patients who were found to have MET exon 14 skipping either on tissue biopsy or on liquid biopsy, both the subsets responded very well. And in the previously treated patients, the response rates were 48%. In treatment naive, they were 66.7%. The same thing shown in this table. And coming to adverse effects were assessed in 88 Asian patients. The most common adverse effects were peripheral edema, increase in creatinine, and diarrhea. 29% patients had grade 3 or greater adverse effects, but it led to permanent discontinuation of treatment in only 14.8% of the patients. The quality of life remained stable in most of the patients, and those patients who responded, in them, the scores of symptoms like cough, dyspnea, and chest pain showed improvement. So to conclude, in the Vision study, Tepotinib has shown robust and durable clinical activity in Asian patients also. The adverse effects were manageable. Around 15% led to treatment discontinuation. Currently, Vision study has already enrolled 106 Asian patients. Analysis in the entire population is ongoing. Thank you very much.